Hello. This presentation introduces you to the Seasonal and Pandemic Influenza Vaccination Assessment Toolkit, the SPIVA Toolkit, developed by the San Francisco Bay Area Advanced Practice Center. The San Francisco Bay Area Advanced Practice Center is a partnership between the San Francisco Department of Public Health and the Center for Infectious Diseases and Emergency Readiness, UC Berkeley School of Public Health. Our work is funded by the National Association of County and City Health Officials. The San Francisco Bay Area Advanced Practice Center is part of the network of the APCs throughout the United States. In this presentation, we will provide you an overview of the Seasonal and Pandemic Influenza Vaccination Assessment, or SPIVA Toolkit. We will discuss some development assumptions, describe how to use the SPIVA Toolkit, and present some benefits of using the toolkit for emergency preparedness. In the SPIVA Toolkit, we have several components. Highlighted is community assessment for emergency preparedness, and we describe several data collection methods: key informant interviews, focus groups, and surveys. We further describe the surveys by using a methodology that we've titled 7 Steps for Highly Effective Surveys. We also describe the use of software and online tools, and we include appendixes. Among these are a question bank, example surveys in English and Spanish, a job action sheet, and a relational database creation guide. The SPIVA Toolkit highlights community assessment as a tool for emergency preparedness to help inform current and future planning, marketing, and risk communication activities. We suggest incremental and continual planning for more efficient emergency preparedness efforts. And by using the tools in this toolkit, they may be applied to seasonal and pandemic influenza as well as other public health campaigns. In the development of this toolkit, we assumed the following. 1, that in a national emergency, state and federal guidance may supersede local planning assumptions. And yet this toolkit provides a framework for a wide range of scenarios without undermining official guidance. So here's the current public health situation. Low vaccine uptake in many communities, hard to reach populations in local health department jurisdictions, ambivalent or hostile attitudes toward vaccination, not enough information about our communities. If any of those sound familiar, we believe that assessments can provide solutions. Assessments allow us to measure vaccination rates in specific subpopulations, identify how best to communicate vaccination clinic information. They provide insight into methods for reaching at-risk populations, and supply feedback from community members to improve planning. In the SPIVA Toolkit, we promote an incremental approach to assessment. We describe key informant interviews, focus groups, and community surveys, where the findings of key informant interviews inform the design and development of protocols for focus groups, and the findings from focus groups in turn inform the design and development of community surveys. What are key informant interviews? An in-depth conversation with an expert, or a key, someone immersed in a community of interest. Key informant interviews provide knowledge, opinions, and advice, and they are a simple and direct approach to data collection. Focus groups are a means to gather input in small group settings. They pre-test assumptions and ideas, and they allow us to determine key questions for further in-depth study and analysis. Community surveys are a method for collecting population-level information. The findings reveal trends, attitudes, opinions, and knowledge in the community. They require planning and development. Towards that planning and development, you'll find within the SPIVA Toolkit the 7 steps for highly effective surveys, a methodology that describes how to define survey goals, select a study design a sampling plan, design the questionnaire, pilot test the survey, conduct the survey, and communicate findings. Earlier I mentioned the incremental approach to assessments highlighted in the SPIVA Toolkit, the use of key informant interviews to inform focus groups, to inform community surveys. When does one do all of this? We propose 2 models. One of them is that in any given calendar year, there are many opportunities to conduct data collection. In this graphic, we see that a survey could be conducted before a vaccination clinic, during the vaccination clinic, or post a vaccination clinic. Alternatively, we could study different communities in a series of years. Year 1 might be to study Community A, Year 2, Community B, and Year 3, Community C. Over a series of 3 years, our findings would yield information that allow us a wider familiarity and knowledge about particular characteristics, behaviors, preferences, attitudes, and knowledge levels of different communities. The benefits of using the SPIVA Toolkit are that local health department staff will be trained in practical community assessment techniques. Local health department staff will recognize available online resources for survey design and analysis. As well, local health department staff will be able to distinguish among implementation and management requirements. We present some of those considerations interspersed throughout the SPIVA Toolkit by using at-a-glance tables and easy-to-read tip sheets. We suggest that using the SPIVA Toolkit in part or as a whole. The appendixes can be used as standalone resources to augment existing preparedness plans and overall to enhance ongoing community assessment. The outcomes we expect with continual use of the methods suggested in the SPIVA Toolkit are that local health department staff will be trained in community assessment methods, that there will be improved mass vaccination planning and coordination, that effective targeting and marketing will occur to involve vulnerable populations in activities involved in mass vaccination planning and implementation, that there be community participation not only to receive the services provided by local health departments such as vaccines, but also in the design and development of the methods used for data collection. And in the long term, that with all of these activities, there will be increased vaccine uptake. We have presented an introduction of the SPIVA Toolkit. For a complete view of the seasonal and pandemic influenza vaccination assessment toolkit, the SPIVA Toolkit, please visit the website of the San Francisco Bay Area Advanced Practice Center at www.sfbayapc.org.